In Chapter 5, the cardiovascular and lymphatic system discusses a condition called deep vein thrombosis, also known as deep venous thrombosis, or DVT. The word thrombosis breaks down into throm, meaning blood clot, and osis, meaning abnormal condition. It is an abnormal condition of blood clots in the deep veins. The textbook states the definition as the formation of a blood clot in the deep vein of the body, occurring most commonly in the legs or thighs. However, they can be present in the arms as well. The schematic on the right indicates a thrombosis in the deep vein that causes swelling below the clot while disrupting blood flow to the heart and lungs. DVT can occur when blood flow to the veins is slow or blocked and can develop due to underlying medical conditions that affect how blood clots. People with the following factors are at an increased risk for developing DVT, such as sedentary lifestyle due to bed rest, sitting for too long without movement, long travel or airplanes, family history of blood clots, illness, accident, individuals over the age of 60, however it can occur before then, oral contraceptives, obesity, smoking, and cancer. There are many signs and symptoms that vary across gender and individuals. Some include sudden onset of shortness of breath, skin that is warm to the touch, discoloration of the skin, typically red or darker, and painful or swollen extremities known as edema. However, some people display asymptomatically. The image shown is a patient with DVT. As you can see, they have spotted discoloration of the lower leg. Just to the right of that shows the difference between normal venous flow and the formation of clots in DVT, showing protrusion of the vessels. DVT is a life-threatening emergency and should be diagnosed within 24 hours of onset of pain. DVT diagnosis can be achieved with several different tests. The most readily available is ultrasonography. The prefix ultra meaning excess or beyond, sono meaning sound, and graphy meaning process of recording. The book defines ultrasounds as a radiographic procedure in which a small transducer passes over the skin, transmitting high-frequency sound waves that bounce off body tissues and are then recorded to produce an image of an internal organ or tissue. A Doppler ultrasound is a specific type of ultrasound that can be used to detect alterations in blood flow caused by blood or plaque in arteries or veins. This is an image of a Doppler ultrasound being conducted on a patient's carotid artery. Upon positive diagnosis of DVT, a doctor may prescribe anticoagulants to help reduce clotting while attempting to avoid further complications. Anti meaning against, and coagulation meaning the process in which blood clots are formed, defined as against blood clot formation. Warfarin, also known as Coumadin, is a commonly prescribed anticoagulant to treat DVT. On the other hand, if a patient cannot be prescribed anticoagulants, the entire blood clot could be removed in a process called thrombectomy. The suffix ectomy meaning excision or removal, and again the word thromb meaning blood clot. The image on the right is a full removal of a blood clot which measures greater than 12 inches in length. DVT offers many complications. One is a pulmonary embolism. The suffix "ary" means pertaining to, pulmo meaning lungs, embol meaning embolus or plug, and ism meaning condition. A pulmonary embolism occurs when the clot breaks loose and travels to the lungs, causing a blockage. The image shows an embolism traveling into the lungs, causing a block, which can lead to damaged lungs and to potentially necrosis or cell death of the tissues. DVT and pulmonary embolisms can both be referred to as venous thromboembolisms. Suffix "us" meaning condition or structure, and combining form "veno" meaning vein.